All righty, let's get going here. Thank you everyone for taking the time today, whether you are on your lunch break or you're like me and it's still bright and early here on the West Coast. We're excited to have you for Medicare Advantage Uncovered, Benefit Design and Growth Strategy in a Rapidly Changing Market. Today, I am joined by my colleague Ali Youssef, Principal Product Analyst here at Unite Us, supporting the Insights Growth product, as well as myself, also working on the Insights Growth product. And we're excited to be here today to walk through some big changes and trends for the upcoming year. So before we jump in, I wanted to provide you all a little background about Unite Us. We are your trusted partner in transforming social care. With over a decade of proven expertise, we deliver end-to-end solutions tailored to meet organizations where they need us most. Whether you're looking to streamline manual workflows, improve care coordination, or address critical social determinants of health, our flexible suite of solutions adapts seamlessly to your unique challenges. Our comprehensive technology suite, which includes Insights Growth, empowers health plans with actionable market and member insights and supports member acquisition, enables seamless management of whole person care. By plugging into your existing systems and current processes, we ensure a scalable, sustainable approach to building healthier communities. And we're excited to share some learnings and trends along these same lines with you here today. So thinking about what's on the agenda for today, we are going to be running through the list here on the left. And obviously we've already done introductions, and then Ali will dive into some market dynamics and benefit trends. And then I'll head back in to look ahead and talk about strategies for the upcoming year. So we're excited to share some insights with you all, and I'll pass it over to Ali to get us going.
Perfect. Thanks a lot, Morgan. 2025 is shaping up to be a pivotal year for Medicare, with many factors influencing the future of this space. And here we want to go over a couple of the key market trends to really watch out closely for. So the first one is going to be the Inflation Reduction Act. First, Inflation Reduction Act did pass. While it did introduce a lot of great benefits for consumers, including capping insulin costs and also lowering out-of-pocket limits, we are now seeing payers responding by raising some costs and also reducing benefits. And there's also a lot of plan exits in markets, which we'll go over in a little bit. The second is going to be that we are seeing higher utilization and increased costs in the Medicare space. This is especially impacted by the fact that more seniors are enrolling in Medicare Advantage than ever before, and also the impact of delayed care due to COVID-19 and the broader trend in rising healthcare costs that are happening now. And then we are also seeing slower MA growth overall and more market saturation as the Medicare Advantage competition is reaching its peak with less growth overall in the past 2 years. We do foresee the potential privatization of Medicare, but at this time, really the large payers are the ones poised to capture this opportunity, whereas the regional payers are still struggling to maintain that market share. So another big trend to watch out for. And then all of these factors are leading to payers having to navigate MLR challenges and profitability issues. This is particularly affecting the regional payers who are struggling to balance the healthcare costs and really maintain that profitability. And then finally, the Medicare Advantage consumer base is evolving. Consumers are becoming more tech savvy and they're more likely to switch plans. And this is reflecting a broader shift in shopping habits that Medicare Advantage payers should look out for in the next couple of years here. So with all of these factors, let's get into some of the key market dynamics, particularly around plan movement and benefit offerings that are shaping up what this AEP looks like. All right, so for this first slide here, we're going to be covering overall Medicare Advantage competition. The overall competition is on a steady downfall here. As you look at this chart, We are going to be showing non-SNP Medicare Advantage plans in this slide here, and we're going to be showing the trends over the past 5 years. So if you look at 2021, you can see that plan offerings did increase by 8%, and then again by 6% in 2022. I'd say that's really the height of the Medicare Advantage growth as more payers were entering the market, more plans were being introduced across counties in the nation. But now we are seeing some of that negative growth in the MA space. In 2025, there was a 5% negative decrease. We did see 5% less plans overall. And then comparing 2023 to 2024, it did sort of level out in the number of plans, but now we are seeing it starting to shift. And this is a trend that we do expect for the next couple of years here. We are expecting less plans being offered overall. And then just to orient everyone on the data that we used, if you look at the bottom right here, you can see all of the filters that we use for this particular slide, and we'll have them on all of the slides. So here we're looking at non-SNP, non-EGWP, Medicare Advantage plans, and we're also excluding MSA, PACE, and fee-for-service. And all of this data can be found on our dashboard, as well as a lot of other data that we're going to be going over in a second here. Really excited to continue sharing all of the overall trends. So to visualize what this looks like on a state level, you can see that most states had more exits than entrants this year. Around 80% of states saw more plans exits than entrants, with Vermont and North Dakota really leading this trend. Looking at this chart here, the darker blue shade does represent the plans that had more exits than entrants. So it does show the ratio, and the darker ones had the most exits versus the lighter ones that didn't have as many exits. So if you look at the overall map, you can see that it's really around the East Coast region, also the Midwest and the West Coast were the ones that were particularly had more exits than entrants. And a lot of these exits, as we're looking at, the specific states, we are seeing that they're in rural or underserved communities. So these people are finding themselves with less plan choices than before. Payers are making strategic decisions around, which markets they want to stay in, looking at, their profitability concerns, seeing if they want to exit some markets. And we are also seeing a lot more consolidating of plans. So when a payer, for example, they had 10 plans, now they might be offering 7 or 8 plans just to, lessen the amount of plans that they're offering. So I'll pause there for a second just so everyone can sort of observe this map and see, the trends overall, and how it's affecting the nation. Perfect. And then comparing plan entrants to exits nationally, we are seeing a significantly higher amount of exits than entrants this year. Just to orient everyone on the chart here, so the blue bar is going to represent the entrants, and then the slightly pinkish color is going to represent the exits. So you can see that starting in 2021, there was a lot more entrants than exits. And that was really the height of the MA growth as a lot of plans were entering new markets. But you can see that each year we are seeing less and less entrants and we're seeing more exits. And in 2024, that was really the first year where we had more exits than entrants. There was around 53% more exits than entrants in 2024. But now in 2025, there are around 80% more exits than entrants. So we are seeing a significant shift in the market overall. And there's also a handful of payers that left the MA space entirely, and they left all of their plans. So it's quite a significant shift here. And then looking at the overall disruption at the county level, so just to look at it in a more granular level, you can see that the disruption is even more striking here, with around 95% of counties that are offering at least one MA plan did have an exit. And for 2025, the total number of counties that we're looking at that did have a Medicare Advantage plan were around 3,100, and around 95% of those counties had at least one exit. And comparing that to 2021, you can see only around 55% of counties had an exit, but now it's nearly all of them. And we are expecting this trend to continue. This is leaving consumers with less options to choose from overall, and also potentially threatening a delay of care as, consumers might need to switch plans. They do need to switch their doctors if, the new payer doesn't take their new insurance. They need to find new specialists that cover their new plans. So this is causing quite a disruption in patient care and overall outcomes, which is something to look out for going into the future. And then analyzing the demographics of these counties that did have the most exits. Um, we just to show everybody what we're looking at here. So looking at this chart, um, we have the counties with the most exits on the left here. And we have the ones that didn't have as many exits on the right. What we define as high exit counties are a county that had at least 3 plan exits and also had at least 100 enrolled members impacted. So looking at the chart, the bar on the left here, you can see that the pinkish color here is going to be the BIPOC population, BIPOC and low income population compared to the white population. So around 38% of these counties that had high exits did have, 38% of the population were BIPOC, compared to the counties that didn't have as many exits, where only around 28% of the population was BIPOC. So this is especially impactful as these populations tend to be higher acuity, and they don't have as much access to care. So these consumers are finding themselves with less options to choose from, and they could select a plan with higher costs or decreased benefits overall. So definitely something to look out for in the future. And then finally, in terms of exits, looking at the plan type. So we did cover where these exits are happening. We covered the demographics, but what are these types of plans? What's being impacted? You can see that we're seeing the majority of these plan exits in PPO plans, with around 50% of the exits this year being PPO. Only around 35 are HMO and 16% are PPO, HMO POS. So this is a big shift, as in the previous couple years, there was a big rush to PPO plans. All of the payers were offering PPO because, that gave members more flexibility to go out of network. And these plans are becoming harder to administer and more costly as well. So we are seeing a shift in that, and we're expecting more HMO offerings in the future here. And we may also might be seeing more switching to med sub plans in particular, as those, members that did have the PPO plans did appreciate the flexibility to go out of network. And since they're losing that, we may be seeing more of that switch to med sub. Perfect. And so while we're seeing non-SNP plans decline, we are observing a rise in special needs plans. The average growth for SNP plans over the past 5 years has been 11% year over year. So this year we are seeing 1,500 SNP plans being offered. And comparing 2025, that is around 2025 to 2021, that is around 50% increase in the number of SNP plans. So we're seeing a major shift and major growth in the SNP market. This year, we did see the most new SNP plans being offered in Florida, followed by Texas and California. And dual plans were the most popular offering this year. All right, so shifting into this next section, we're going to be covering the plans themselves, what's happening on the plan level, and also some of the benefit trends to look out for. So this year, we are seeing a decrease in average star scores for Medicare Advantage plans. Average star scores have been decreasing year over year, with the exception of 2022, as you can see that the average was around 4.17. And that's partly due to COVID-19. There was some exceptions that CMS did in terms of calculating the average star scores or star scores for payers. But now we are seeing an average score of 3.83, and you can see it sort of decrease each year. The majority of Medicare Advantage enrollees were in a plan that did decrease by a star score or did decrease by star ratings overall. So around 10 million individuals, around 49% of all Medicare Advantage consumers were in a plan that did drop. So we may be seeing more switching just due to that, as you know, consumers are looking for some of those higher scores overall. And then overall, only 7 contracts received 5 stars this year compared to 38 last year. And one thing to note is that higher ratings are getting harder to achieve, as what got plans higher ratings in the past just aren't enough anymore. So it's really important to adjust your strategies, adjust your member acquisition, as well as your engagement. And we're going to be covering that later on and some strategies and how to like bring in your members, how to acquire the members, and also when they're there, how to make sure that you know you're meeting all of their needs, addressing all of their care gaps, and really driving the performance of your plan. And then looking at premiums, we are seeing that premiums increased this year. They are around $19 per average premium. Again, we are looking specifically at non-SNP plans here, but we are seeing that increase. If you look at the previous couple of years here, you can see that we're back to the rates that they were in 2021. So you see that year over year premiums were decreasing. Last year, they were at $14. So we are seeing quite a significant increase of around 35% year over year in premiums. And we're also seeing that, you know, a lot of those $0 premium plans are going away. So this is driving premium averages up. And this, you know, consumers are one faced with less choices overall in terms of Medicare Advantage plans to choose from. And then when they are finding those plans, they are seeing that premiums are starting to increase, which is one of the key factors that consumers are choosing plans for. And then looking at deductibles, this is the area that we're seeing the greatest impact in terms of the Inflation Reduction Act, as a lot of the cost burden was shifted back to the consumer. So you're looking at the average health deductible, which did increase from $45 to $67. So just a little around 50% increase in year over year average health deductible. But then looking at the drug deductible, this is where we're seeing the most impact, as it did increase by 4x year over year. It was around $64, and now the average drug deductible is $249. So, you know, there's a lot of great benefits from the Inflation Reduction Act, such as capping insulin, capping out-of-pocket costs, but some of the shift is being shifted. Some of the cost is being shifted back to the consumers with these higher deductibles. And one thing that's really important to note is that not everyone reaches their catastrophic coverage level, but everybody will pay the extra drug deductible. So it could end up being more cost for the consumers on average if you're looking at it by month over month costs here with these high drug deductibles. And then finally, looking at supplemental benefits overall, we are seeing that the majority of plans are still offering those most common benefits, such as dental, vision, hearing, fitness. They are still being offered by most plans, but we are seeing a significant decrease in some of those less common supplemental benefits. So looking at this chart here, starting with OTC, you can see that it did decrease year over year. Last year, it was offered by 86% of plans. Now it's only offered by 73% of plans. And OTC is particularly important because it is one of those popular benefits that consumers are choosing plans based off. So they are seeing that there's less OTC being offered overall. And then transportation and meal benefit as well. Those did decrease year over year. And these benefits are particularly important as well because they can boost star scores. As we saw on the previous slide, that star scores are decreasing year over year. But these two benefits really address those social determinants of health for members. If a member can't doesn't have transportation and they can't go to their provider, then that could impact their overall health. If they don't have meals, then that could also impact their overall health, which does lead to more costs for payers down the line. So two things to definitely consider as we're looking at the amount of benefits being offered year over year. The exception to all of these, decrease in supplemental benefits is Part B. We did notice an increase in the Part B rebate, which was interesting year over year. We do think that the reason for this is to supplement or, offset some of those higher costs that the members are paying now. So we are going to continue looking at this and seeing what the trend looks like year over year. But overall, are seeing, less benefits being offered, higher cost shares, as well as some of those exits in the counties. So these are the major trends that we're seeing. And in the next section, we're going to be talking about, just the sales strategy and acquiring new members, as well as making sure that, their conditions are met and how to boost your plan's performance. So I will pass it to Morgan to take it away.
Thanks, Ollie. So obviously, based on all those wonderful slides and talking points, there's a lot of change occurring right now in the MA space, a lot of movement. So you might ask, how is this impacting the strategy of MA plans as they're in the throes of AEP and looking towards 2025? So first, obviously, we're observing more cost-efficient sales strategies, and a focus on in-house outreach and teams really thinking strategically about vendors and external partners that they're working with. In a similar vein, although teams are still looking to acquire new members, we've seen a big dip in prospect counts this year that have been marketed to actually as compared to years past. And it's definitely a demonstration that not only are budgets tight, but that people are really needing to think intelligently about who they're targeting and who they're trying to attract to the plan. This is where tools like predictive models and truly understanding your core consumer becomes integral as we're looking to drive that marketing dollar further. So how does one make a smaller budget go as far as larger budgets have done in years past in terms of overall enrollment? Well, again, it's about targeting those correct individuals for your plans. We at Unitas have actually worked with a lot of plans in years past, leveraging predictive analytics to drive marketing budgets further. In particular, identifying those prospects that are most likely to join a plan or engage with a product offering or particular engagement channel. Predictive models and similar strategies is a place that we do expect to be an area of investment and focus as we continue through AEP and into next year. Third, we've seen a lot of teams leaning on digital and email marketing this year. We've seen a lot of progress with digital marketing engines and tools in recent years, and the use of those channels has definitely reached more full adoption as we think about 2025 AEP. And again, thinking back to that targeted acquisition strategy, digital channels allow for very targeted outreach, which may not be feasible in channels like direct mail or alternate ones. And given the limited budgets and more tactical growth strategies, some plans are just kind of focusing on that this year rather than other strategies. And again, that's not to say that direct mail has been left to the wayside, but that targeted focus with higher ROI is a big focus this year. And then, of course, last but not least, we can't forget about new to Medicare. It is at times easier to grab someone during their age-in window than it would be to sort of snag them away during AEP from another plan. So we've been seeing a lot of plans either lean into their new to Medicare strategies or start to develop more targeted approaches as we're considering, market shifts overall. So that is the evolving sales strategy as a result of those trends that we've talked about. But how does this all come together? So I have my little timeline slide here, and I'm excited to walk you all through it. So how have we changed since prior to the pandemic, and what does the future hold? Well, we know that 2019 was all about acquisition, acquisition, acquisition. Plans were adding new contracts, new offerings. They were expanding footprints. They were driving premiums down and adding all the supplemental benefits possible to get those members in. And we were also witnessing, as a result of the unique situation with COVID in 2020, there was low utilization but high star scores. So all around, things were looking perfect. It was looking great, prior to 2020. But now we're coming into 2024, and as Ali sort of hinted at in his prior slides, plans are really having to adjust to an increasingly challenging and competitive landscape, having to think about the bigger picture as things like high MLR and limited marketing budgets are coming to fruition. We're seeing a lot of plans having tactical exits from certain counties and geographies. And as Ali noted, they're pulling back a lot of supplemental benefits and increasing costs, whether that's a result of the Inflation Reduction Act or trying to offset some of those utilization costs. And we see star score struggling overall. It's just all around kind of a tough environment to be in as an MA plan. Overall, I think COVID as a whole and the lower utilization associated with it kind of gave the MA space a more comfortable feeling than maybe what was actually going on. And now in 2024, we're really seeing the pinch 5 years later. So what does that mean for the future? When we think about 2025 and beyond, there's a lot to keep in mind. Obviously, there's the potential for further privatization of the Medicare space. And to Ali's point, although this may seem like a benefit and an exciting time to be an MA plan, it's the nationals that are really poised to capitalize on this. And plans are really going to have to start to be being strategic about how they get ready for that and how they are going to approach that change and that opportunity and think about surviving through it. Furthermore, of course, as always, there's going to be ongoing pressure to reduce healthcare expenditures as populations continue to age. The boomers are only getting older. So it's really time to start thinking about how to maintain population health, but also revenue at the same time. So a lot to think about, obviously, and we really have to think about not only, like we did in 2019, which was acquisition, but now it's more of a question of how do I manage my population differently than back then, and how do I set my plan up for success knowing how much the environment has changed. So with that, we will talk about how exactly to do that. So 2025 obviously requires a change. In 2019, we were focused on activating members as demonstrated by this bright green arrow here in the upper right-hand corner. However, now in 2025, we really have to think about the rest of this circle or sphere, which includes not only activating and growing your membership, but also understanding your members and answering questions like, who are my members and what are they like? From there, engaging and intervening among your member population. And finally, adeptly adjusting as needed when answering the question, how is my population doing overall? So only by engaging in these steps of this cycle here, which we at Unitas like to call the comprehensive MA member engagement framework, can plans really set themselves up for success in the long term by driving outcomes that make a difference for the member and the plan. So that said, you might ask, well, how do I go about doing this, Morgan? That sounds easy, but it's hard to put it into practice. And I think a lot of plans tend to feel overwhelmed by this because of how siloed some organizations can be for each part of that sphere. But in this case for today, we're going to bring this to life with an example from a Texas-based D-SNP plan. And we are going to use them to kind of walk through how this might actually come to life for a true MA plan using the appropriate tools and insights. So jumping into the first part of the wheel here, it's something we're all very familiar with. It's going to be activation. So we can continue leaning into this, but reframing it more strategically to think about, where do I really want to grow my membership and where can I really make an impact, rather than thinking about all out growth without necessarily a targeted, coherent strategy. So in terms of the Texas D-SNP plan, where do we start in the activation part? Well, first, we want to consider product market fit. Do my benefits as a Texas D-SNP plan align with the prospects that I wish to serve? And do we need to adjust benefits to meet dual eligible preferences and needs? So for example, we know that many dual plan members really find value in that dental benefit. And maybe this Texas D-SNP plan discovers that competitors in the market have a much more robust dental offering than them. So this plan might adjust the max dental coverage to better attract their ideal customers and have them stay for longer. So tools within our wheelhouse at Unite Us, like plan benefit insights, can really help identify opportunities like this. Once the benefit offering has been adjusted to appropriately accommodate these individuals, the plan can start thinking and identifying, can start thinking about targeting and identifying prospective dual plan members in their market, leveraging predictive analytics. So this visual on the left here demonstrates how we might hone in on a right fit member that the organization can wind up targeting and marketing to for an upcoming AEP. Oh, that went really fast. Sorry about that. So looking here, not only are we looking at tool, like a likely to model, much like Unite Us's predictive analytics tools themselves, but we're also looking at likely to respond to direct mail in this case to help align the right people to the actual tactics of our campaign. And overall, these models can really ensure that the right individuals are being identified and targeted so that the plan can ultimately deploy the direct mail marketing campaign that can most likely attract the appropriate members. So moving down the line here, once we target, we engage. We deploy the direct mail marketing campaign in this case, and prep internal sales agents with persona-driven call scripts that can help move the needle even further towards conversion as those prospects raise their hand and call in. And then, of course, once that's all done successfully, you have enrollment. So targeted individuals will wind up joining plans with those salient calls to action at higher conversion rates than what we would expect had we not thoughtfully move through steps 1, 2, and 3 on this activation wheel. So the best thing about being tactical and smart in this activation stage is that by looking at product marketing fit and leveraging predictive analytics to really hone in on the right person, what you wind up with is the right member right away. And you reduce the likelihood for churn down the road when the member perhaps realizes that the plan wasn't the right fit for them. So that's activation. Let's move on to understanding our membership to really fill out the concept of the member engagement framework we have proposed here. So upon activation, it's time to understand your members. In the instance of this Texas D-SNP plan, they're able to uncover insights about their membership and note opportunity areas to drive change and value. So for instance, they can use claims information, predictive analytics, other consumer insights from tools like, say, Unitas's Social Connector to learn more about their membership and identify key clinical and social risk factors that these members might face. Upon investigation in this case, the plan can understand that their dual population relative to most populations over 65 in the age of Texas have these features, one of which is low income, another is being Hispanic. They've noticed that they are primarily based in Hamilton and Burleson County, and these folks have high housing, transport, and utility needs. Further, they have a high incidence of type 2 diabetes, even when compared to other Texas D-SNP plans in their area, as demonstrated by the graph to the right here. So in the end, given these learnings, we can identify the opportunity as improving outcomes for members with diabetes. So now that we understand our members, it's time to actually do something with that information. So we want to focus on the goal of improving outcomes for those members with diabetes, and we're able to intervene and address findings from the prior slide through a workflow very similar to this. So leveraging an example member from our Texas D-SNP plan, Julie here as pictured on the left, we can address those needs. So Julie is a plan member in Caldwell, Texas. She has diabetes, a high A1C, and has utility needs. And the plan can participate in proactive outreach. And Tom from Unitas's care coordination team in this case reaches out to Julie via her preferred engagement channel to ask about her social care needs and refer her to resources in her community to help them get met. So Unitas's platform then provides a robust capability to be able to respond to individuals like Julie with social needs and really get those needs met. Meanwhile, the plan itself, a member engagement team member can let her know that certain benefits are being underutilized that can help her manage her diabetes, say, including a nutritionist benefit. From here, Julie is able to connect with one or more community partners to get her social care needs met, and she can now receive a utility bill assistance to help ensure her air conditioning remains on, her lights remained on, and that her insulin remains cold. And as told by the plan engagement team, she's able to have regular meetings with a nutritionist to really help manage her diabetes. The great part about this sort of flow is that Julie's needs wind up being met, and she's able to focus further on addressing her condition, including consistently taking her medications and eating healthier. So this is a great framework in which to think about intervention and addressing the goals identified on the prior step of our circle. So you made it through all three steps, and we're finally on the assess phase. And I know it's a lot of content, but I think this is where it really all comes together. And we're able to assess and review the results of all those findings and actions that we took in steps 1 through 3, and determine steps for the plan as a whole going forward. So leveraging reporting and insights, the Texas D-SNP plan in our example can understand how outcomes have improved and if they have met their goals. We can assess intervention and impact with data and establish where to go next. What's great about the comprehensive MA member engagement strategy is that we've proposed here is that based on results, you can pivot to any part of the wheel to further address any particular item. So for instance, if you're seeing success in populations with risk management and outcomes, you can go ahead and try and increase enrollment yet again with further targeting outreach to those desired members. On the flip side, if you happen to have uncovered trends or questions during intervention that require further discovery, for instance, maybe this Texas D-SNP plan, for instance, learned that many members with diabetes actually said they have a hard time covering prescription costs during your calls. You can research that trend further through the understand phase of the wheel and note further opportunities to drive change. So really exciting way to sort of think about, how do I sort of address change and drive plan success holistically through activation, all the way through assessment and reviewing results. One last thing I'll ask you to keep in mind here, as well as we think about this framework, is that this can apply to any type of member. It doesn't have to be a new or existing member. It can also apply on the flip side to a member that's at risk for disenrollment. So for instance, activation in this case becomes engagement to retain a member, and we can further understand said members that are likely to disenroll and engage in outreach and intervention to help prevent their churn long term. So something to think about there as well. So bringing it all together, here it is all on the same slide. Once again, we can summarize it here. And generally, I think that this framework really sets up plans for success, moving just beyond that activation piece, which was so popular, 5 years ago, and focusing on other steps in this framework that can drive meaningful long-term plan outcomes and success, which will be especially critical heading into 2025 and beyond, given the stress that the market is under. So focusing on these 4 questions as outlined here: what member population do you wish to grow? What are your members like? What behaviors do you want to promote? And ultimately, how is the member population doing? Allows you to thoughtfully think about how to drive outcomes like increasing market penetration, increasing member satisfaction, improving clinical and social outcomes, and reducing unnecessary medical spend. A real-world example of how this framework may come to life with real members is the North Carolina Healthy Opportunities Pilot, the nation's first comprehensive pilot program to evaluate the impact of addressing health-related social needs for high-risk Medicaid enrollees. Although these findings were focused on the social services aspect of our comprehensive member engagement strategy, the results were quite impressive nonetheless. And the study found that significant ED utilization use was reduced. There was a reduction in inpatient utilization, a reduction in the risk of a member disenrolling early, and reduction in total number of social needs across populations. So that is an example of this coming to life in the real world and really having an impact. Moving on to our final slide, and then we can hop into Q&A. I just wanted to quickly review what we've covered today, and then we can, answer some questions that you may have. So we have reviewed some national benefit trends and plan movements with Ali. And in the last half of the presentation, we walked through that comprehensive member engagement strategy framework as the new golden standard for how MA plans should be thinking about plan growth and plan strategy heading into, an increasingly complicated future. So we're so happy to share these insights with you today, and feel free to drop any questions you may have in the Q&A box in the chat. So Ali, I'm seeing here Looks like a question from the chat. Have you noticed if the market exits are more from regional players or from nationals?
Yeah, that's a great question. So this year we did see 924 exits. 62% of them were national, 38% were regional. So we still are seeing more nationals exit than regionals. But looking over the past 5 years, regional exits were more stable. But this year we did see quite a significant increase in regionals. Last year it was a lower percentage overall, but this year it is 38%. So slowly getting closer to half and half. And we can expect more regionals, especially as some of these higher costs and higher utilization, we may expect more regionals to be exiting the market as well.
Perfect. Thanks for that, Ollie. And I think this next one I'll take. The person asks, how have your health plan customers leveraged your data to optimize their AEP marketing spend, particularly for different product lines aimed at different audiences? So I think this is a great question, especially considering some of the things that we walk through in the green phase of our circle here, the activate phase. In the past, a lot of our customers have typically started by not only sort of understanding their membership, but also understanding, what they want to do with their marketing strategy for this year. So thinking about what the messaging is going to be, thinking about what channels they hope to use. And then from there, we really help optimize that marketing spend by helping plans identify those prospects in their market that are best aligned to their plan and the tactics that they're planning on using. So in this case, if we think back to that dual example, a lot of our plans will use models like that, likely to be a dual Texas member, for instance, to identify a target population, and then they'll layer on channel models or engagement models on top of that to further drive, their budgets further with similar conversion rates, but less need to target as many people. When we're thinking about different product lines, we've worked with a lot of plans recently who have been coming out actually with lower income focused plan offerings, where we have layered in things like income or likelihood to prefer a $0 premium or low drug cost plans to really help them hone in on that particular population, and have a set strategy for that set of membership for the low income plan. And then on the flip side, maybe for their more traditional MA plan that's focused on more higher income populations, maybe it's a PPO plan, leveraging those specific models as well to kind of segment how we approach each different plan offering. And last but not least, I think we have one more, unless we have any others come in. How do I evaluate which benefits to pull back on versus invest in? Curious if you have any thoughts on that, Ali.
Yeah, for sure. It's a great question. So couple strategies in terms of really identifying those key benefits to either pull back on or continue investing. So the first one is really understanding the utilization of benefits, looking at your members and seeing what they're utilizing the most and seeing what they really appreciate. So for example, OTC is one that I always like to reference because OTC is one of the most popular benefits. Everybody wants it. It's one of those shiny items that consumers, like to pick plans based out of. But then when you look at OTC's utilization, it's only around 20 or 30% of members are actually using it. So it's one of those benefits that, even investing further in will go a long way since it's not utilized by a lot of members, or it is utilized, but it's maybe they might not use the full OTC amount. So that is one, just looking at understanding the utilization, understanding what your members want. Another thing is also looking at some of those different benefits that you can offer. So around 99% of plans offer some supplemental benefits. Most of them offer, the dentals and the vision and all of those benefits. But so looking at what else you can offer that's unique to the market. So for example, Part B rebates are ones that are really growing in popularity, as well as caregiver support. So looking at what are some of the other benefits that you can offer. And then finally, really just understanding your members. I'd say that's key. And as Morgan was sharing earlier, just really understanding your members, understanding the things that they benefits that they care the most about. So understanding your members will go a long way in terms of really differentiating your plans and offering the benefits that they want the most.
Great. Yeah, that's super insightful. Thank you. That was a great question too. So another thing I'm seeing in the chat is how do plans remain competitive with nationals, especially thinking about further privatization? So I can go ahead and answer that one. So I think there's a few things to consider here. Number one, we are seeing a lot of pressure on healthcare costs right now for regional plans in particular. So thinking about MLR and how expensive it is to manage certain populations. So I think there's a few things that plans can do, regional plans can do to remain competitive against nationals right now. And that's really thinking about what type of members you want to attract and really honing in on them, right? So attracting those that can really, help support your plan, and also addressing strategies in which your current membership, you can help them essentially be healthier and manage some of the risk that they might be facing. So those are two things to think of. In addition, I would also say that when considering privatization, it will likely exacerbate that strain on plans that are already struggling in a market. So as we head into the next 4 years, the next 8 years, that type of thing, really fine-tuning ways in which you can really implement this engagement strategy for your membership to help reduce costs as quickly as possible for your plan is going to be important to survive. And it's really important to your membership as well, because if you're not able to be in their market serving them, they might not be able to continue their care with the specialists that they like. If you're hospital integrated, they might not be able to go to that system anymore. So really doing this as a service, not only to your long-term health as a business, but as a service to your community. So really staying on top of that and attracting the right members as well. We'll do one more question here and then we'll probably close it out. So Ali, I might kick this one to you. Do you think that the reduction in PPO offerings or the sort of the beginnings of that is driven primarily by plans finding it harder to control MLR in a wider network? If not, what would you consider the top 2 to 3 drivers of this trend shift?
Yeah, that's a great question. I would say that I think the majority of it is driven by MLR. Payers are just finding it a lot harder to administer those plans, those out of pocket or the plans that allow you to go out of network. So I think that is a large driver, but I also do see that one, I feel like when plans did offer those PPO plans in the past couple of years, they were just offering a lot of plans and offering a lot of them across the different counties that maybe they should have offered more of those HMO plans. So I feel like one, it wasn't the most strategic approach, since that was the nationals that were really driving the move to PPO, and the regionals started to following that trend as well, even though MLR profitability issues were a concern going into that. So that's one, but also the higher healthcare costs is another factor, as well as there's been a trend in health systems not accepting some Medicare Advantage plans. So I think that could also be another factor here as well, as we've seen a lot of health systems across the nation start to not accept Medicare Advantage plans. So overall, it's just not the right environment for some of those higher cost plans. And that's why we're seeing more of that shift back to HMO for a lot of payers in the nation.
Great. Yeah, that was a really good question as well. Everyone's bringing the good questions today. I love it. So
Great.
if there's any other questions in the chat that we weren't able to get to, we will have some folks follow up with you. But thank you for being with us today. And we are obviously very excited to see how the rest of AEP goes. So, feel free to reach out, let us know. Otherwise, we will see you all again at the next one in early next year. Thank you.
Thanks a lot.